How Obamacare works. Welcome back to the Stuff Did You Think About podcast, where we take everyday questions, strange facts, and fascinating topics and break them down in just a few minutes. Today, we're going to talk about something you probably heard about hundreds of times, but may not completely understand how Obamacare actually works. Now, first, Obamacare is just the nickname. The official name is the Affordable Care Act, or ACA, and it became law in 2010. The main goal was pretty simple: help more Americans get health insurance and make it harder for insurance companies to deny people because they were sick. Before the Affordable Care Act, if you have something like diabetes, cancer, or another serious medical condition, insurance companies could refuse to cover you or charge you a lot more money. Today, they generally can't deny you coverage because of a pre existing condition. Another big change was that young adults can stay on their parents' health insurance until they turn 26. That helped millions of people who were just starting their careers or still in school. One thing people often misunderstood is that Obamacare isn't one government health insurance plan. Instead, it's a law that created health insurance markets where people can shop for private insurance plans. If your income falls within certain limits, the government may help pay part of your monthly premium through tax credits. That means some people pay much less than the full cost of their insurance. Another part of the law expanded Medicaid in many states. Medicaid is a government health insurance program for people with low incomes. Not every state chose to expand Medicaid, though, so depending on where you live, the rules can be different. The Affordable Care Act also requires insurance plans to cover certain preventive services, like many vaccines, health screenings, and annual wellness visits, often without charging you a copay. The idea that catching health problems early can keep people healthier and reduce expensive medical treatments later. Now, some people really like Obamacare because it made health insurance available to millions of Americans who didn't have it before. Others criticize it because they believe insurance premiums and deductibles can still be expensive, or they disagree with how much the government is involved in healthcare. So, whether someone supports it or not usually depends on their personal experiences, where they live, and their views on healthcare policy. The important thing to remember is that Obamacare didn't replace private health insurance. Most people who buy coverage through the Affordable Care Act are still buying plans from private insurance companies. The law mainly changed the rules about how health insurance works and who can get financial help paying for it. So the next time someone mentions Obamacare, you'll know they're really talking about the Affordable Care Act, a law designed to expand access to health insurance while changing how insurance companies operate. Thanks for listening to the Stuff You Should Think About. If you enjoyed this episode, be sure to follow the podcast. And if you have a question or a topic you'd like us to discover, keep thinking, keep asking, and we'll see you next time.